Anemia prevalence, time trends, and disparities in the U.S. population. Examination of NHANES 1999 to 2020. Anemia is the most common blood disorder and affects more than 3 million Americans. The presence of anemia has significant association with increased morbidity, all-cause hospitalizations, and all-cause mortality in adults. Serious adverse effects associated with anemia are observed in patients with a variety of diseases, for example, heart failure. Older data suggested that the prevalence of anemia was rising in the general population. However, recent estimates on anemia prevalence and time trends in the general U.S. population are lacking. The objective of the study is to estimate the prevalence and time trends of anemia in the general U.S. population and examine how these estimates differ by race, gender, age, and household income. The study used National Health and Nutrition Examination Survey known as NHANES, which is an ongoing cross-sectional, multi-stage, stratified clustered sampling design survey representative of civilian non-institutionalized U.S. population. Each NHANES survey from 1999 to 2020 consists of about 10,000 individuals of all ages and genders. Persons over 60 years, African Americans, and Hispanics are oversampled to produce reliable data. The data collection for 2019 to 2020 cycle was interrupted in March 2020 due to COVID-19 pandemic, so the data collected from 2019 to March 2020 is combined with data from NHANES 2017 to March pre-pandemic data. Anemia was defined using the World Health Organization definition. Prevalence rate was calculated for overall population by gender, age groups, race, and household to income poverty threshold ratio. Household income to poverty threshold ratio was defined as less than or equal to 1, representing household income less than or equal to poverty threshold, and greater than 4 represented household income greater than 4 times the poverty threshold. First, the participants included in the analysis. There were a total of 87,554 participants with a mean age of 34.6 years. Women consisted of 49.8% of the population. The mean hemoglobin is 13.8 milligrams per deciliter, and the average household income to poverty threshold was 2.3. In terms of race, 37.3% were whites, 29.8% were Hispanics, 23.7% were blacks. Second, the anemia prevalence by race, gender, age, and household income to poverty threshold. The lowest prevalence of anemia is noted in the 6 to 15 years age group, and the highest prevalence was noted in the 65 and older years age group. Anemia prevalence was significantly higher in African Americans than in whites, Hispanics, and other racial groups. The anemia prevalence was higher in women with 7.86% than in men with 3.57%. Lastly, there was an inverse relationship between anemia prevalence and the household income to poverty threshold ratio. Participants with HIPR less than or equal to 1 had the highest prevalence of anemia, while prevalence of anemia was lowest in participants with HIPR greater than 4. Third, the prevalence of anemia over time. The prevalence increased from 4.03% during the 1999 to 2000 study period to 6.49% during 2017 to 2020. Anemia prevalence rose by 0.25% in each 2-year survey cycle. Lastly, there is a significantly higher prevalence of anemia in Black men as compared to white men. There is also a significantly higher prevalence of anemia in white women than in white men. Anemia prevalence is also higher in women belonging to other racial groups than their male counterparts within the same racial group. The study showed that the prevalence of anemia rose from 1999 to 2020. The prevalence was higher in the older age group and minority population groups. As the U.S. population ages, the prevalence of anemia increases at a higher rate. Future health policy changes may need a greater focus on promotion of health, particularly among the elderly and minorities. Identifying factors underlying persistently high national anemia prevalence, especially in women from racial minorities, suggests targeted interventions. Discovering interventions, including public health interventions, that can lower anemia prevalence should be the focus of future research. Prevention strategies targeting subpopulations with higher prevalence of anemia may yield higher dividends. Identifying and preventing anemia and preparing individualized care plans for people already with anemia or at high risk of anemia may need to be included as part of routine delivery of clinical care. Thank you for listening.